Okay, good morning. I think we're ready to begin. Before we begin, there has to be a complete re-engineering of the hotel. So putting up walls and very exciting. Okay, so this is the workshop on implementation science. So welcome. And my name is Ed Frangelo. I've organized this with Andrea Warren and Kenda Cunningham and Rasmi Avila, who are here. You'll be hearing from them shortly. So we will have, as you know, part of this until 12:30 when we break for lunch, and then at 1:30 we'll reconvene and we'll continue at that point. Okay, so my job will be to give an introduction, and then at the end I'll sort of lay out what the rest of the learning lab will look like. Okay. So we organized this in collaboration with, you can turn it down. Thank you. In collaboration with the Society for Implementation Science and Nutrition. And I want to begin with these three questions, which is how I've kind of organized the introduction. Why is there a need, and what's the need to know more about implementation in agriculture, health, and nutrition? What are some big questions about implementation that implementation science should be addressing going forward? And what do we need to do to build this science and to expand its practice? Right, so that's what we'll try to cover. And I'll give an overview in the introduction, but all throughout the whole time in the Learning Lab, we'll be coming back to these thoughts. Okay, thank you. Okay. All right, thanks. I'll just do that. Okay, so let me begin here. So the Lancet Child Survival Series published in 2003 was really a game changer. I mean, it changed the Lancet. Now Lancet has a series on many things. This was an important point, though, in bringing together the knowledge about what we can do to help children survive the early first years when mortality is highest. And that series identified 35 preventative and curative maternal and child health and nutrition interventions, but noted that high coverage was needed, which is about implementation. How do we do that? And then subsequent to that, in the years just following, we were asked by WHO Child Adolescent Health to review what's the evidence on how we deliver delivery strategies and where should we deliver these interventions, which are delivery points. And what we found was that in this review is that there was more evidence for some community and facility points than for others, and certainly for other different kinds of delivery points. Only 25 out of the 35 interventions had at least 3 studies with evidence for at least one delivery strategy. What that really all means is that when you lay out a matrix of interventions versus strategies versus where you deliver them, most of that matrix is empty. We knew very little about the implementation of these interventions. It was also not clear how much evidence is even enough. What do we need? How much do we need to know? And the delivery strategies for which there was some information, what was found was that the ones that were most able to reduce user constraints had the greatest documentation of success. So that's an example early on of where the notion of the importance of implementation was raised. This figure came from the Mainstream Nutrition Initiative work that 3 of us led with some colleagues in ICDRB. And this figure was put together as a way of trying to just communicate the basic notion that in order to be successful, we need to have biological and epidemiologic information about what can work. And there's a long history of doing that. The field of nutrition is about 110 years old, but of course agriculture and health are much, much older than that. So we have a lot of information about that, not that there isn't more to be learned. Social, political, and policy knowledge is important if we're going to get countries to put this on their agenda and to move things forward. And again, in nutrition, it's probably really only about 20 years that we've had a scholarship about that. In agriculture and health, there's a longer history of doing that. But for implementation, implementation is relatively recent, certainly in nutrition. In health, it's maybe a little older than that. There's sort of scholarship about that. Agriculture goes back further because agriculture, for example, in the United States, starting about 1990, there was a beginnings of a science being built about through extension systems, how to learn about implementation and share that knowledge. But the bottom line is that we've invested a lot here, quite a bit here now, and not enough at all here. Okay, so continuing, why implementation science now? Well, first of all, we know that specific interventions can be effective at low cost and relatively controlled environments, in short-term studies or in small scales, but we're at a point where we recognize and all admit that we really need to be able to do this on large scale. So how do we do that? We need to have, the second bullet, strong and responsive systems that promote health and well-being through strategies that are sustainable and that are going to work at a large scale in the real world. And some of the challenges we face in needing to do that are that we know that malnutrition and poor health in all forms are important. It's not just undernutrition, it's excess energy. It's not just infectious disease, it's non-communicable diseases and chronic diseases. And also we know that we need to involve multiple systems that are agricultural systems, food systems, education, health, et cetera. All right, so that's a big challenge. And the third bullet is that we've now made commitments, that the Sustainable Development Goals represent commitments, global commitments and country commitments to trying to be able to make progress in these things, and then other commitments like national commitments for universal health coverage. All of those are going to require implementation and knowledge about implementation if we're going to be successful. So a couple of weeks ago, Rahul Rawat of the Bill and Melinda Gates Foundation gave a presentation, and I borrowed some and adapted some of what he said, because what he said was useful and important. In terms of what the need is, Rahul suggested that, first of all, we need to refocus on the implementation of interventions and programs rather than the intervention impacts of the implementation that we managed to get done. So the focus has to be on implementation. That more study where implementation is the main outcome, not just a byproduct that maybe we get to, but we need to look at that as an outcome of an interest in its own right, such as feasibility, adoption, et cetera. That we need to consider different phases of implementation, not just implementation as it happens to be nested within process evaluations or long-term impact evaluations, where often that's the only resources we get to do implementation science, is because we sort of borrow money from the process evaluation, for example. And then the last point, to determine what affects implementation quality across multiple domains, and more importantly, how do we then improve that? So the second point was about big picture questions. And I'm just going to give some examples from a conversation that Sujata Bose and Jessica Escobar and I have been having in the context of the next generation of Alive and Thrive. But these are meant to be sort of just general thoughts, specific, just examples. So some of the questions that we were thinking about were, how can programming be integrated into and strengthened in existing systems and platforms at various levels? How can data and implementation learning be used to improve quality and coverage? What conditions, strategies, and methods are needed to enable country-level scale-up of what we know is effective? And then some others, how do we motivate individuals to adopt and sustain behavior change? This is not just the end intended beneficiaries. This is all of the people who are involved in implementation, frontline workers, the people who supervise them. All of them need to be able to perform at a reasonable level of functioning in order for systems to be successful. And specifically, how can frontline workers be supported? How do we do that in a way that allows them to stay in their jobs and continue to do the job that needs to be done? How can programs be sustained at various levels? And importantly, also, how can what's learned in one place be then shared with others in another place so they're not starting from the beginning? So those are just examples of some big picture questions, the kinds of questions that we need to answer. So we're going to answer those questions, we're arguing, by building further the science of implementation. And again, using a slide, adapting a slide from Rahul Rawat, we need to do that by, first of all, shifting perception of implementation science by stakeholders, and many different stakeholders, shifting the perception that this is worthy of investment and inquiry and effort in its own right, not just because it's helpful to somebody else who's trying to get something else done. That we need to build the capacity to do this, to expand the methodologies in the toolbox that we have, to develop training, including some short courses and webinars. Some of that started to happen already, which is great. To develop and socialize a research agenda that's focused on the knowledge gaps in implementation. That's what a science does, so we need to do that. To institutionalize implementation science as a core component of implementation process among implementing organizations. In other words, this has to be normal within organizations to do this and to share the knowledge, so that we expand channels in order to share the knowledge, and then lastly to expand funding opportunities so that work that needs to get done will be funded. So we're getting some, I would say, support from some places where maybe we might not have expected it so much in the past. For example, the National Institutes of Health in the United States just issued a funding announcement. And this is some of the language from it about using strategies to adopt and integrate evidence-based interventions into clinical community settings, understanding behavior practitioners, support staff and organizations, et cetera. Developing knowledge about how interventions are integrated, and then testing models and theories, conceptual frameworks, building a science, in other words, that moves away from top down to really emphasizing what works at the local level and building in the knowledge from local level. This is really quite a development, because in the past, and still, the National Institutes of Health and other biomedical organizations have tended to use a model that sort of looks like this, which is, you start off with basic research in the lab, and you do preclinical research and clinical research, et cetera, and finally, eventually, something gets to the public health. That model often takes 15 to 20 years to get knowledge really out there. It's called a linear model in some literature. It doesn't have to really be linear, but tends to be linear, but it takes a really long time. We've had some examples recently of other models. So Alive and Thrive in its first phase in Bangladesh, Ethiopia, and Vietnam. The SCN program for infant and young child feeding in Mexico are two examples where the people sponsoring those programs said, no, we're not willing to wait 15 to 20 years. Let's get started right now and learn by doing. So get some bright, committed, talented people together, make the commitment from the beginning to make a difference at large scale in a short period of time, and then have the intention, commitment, and planning to do that, and funding to do that right from the beginning, and just try to do it. So we see examples like that, but doing that required implementation science and was successful because of implementation science in part. And then to finish up, just to emphasize that in any science, we need to bring together perspectives, orientations of discovery and about mission. Discovery is, in a sense, learning for its own sake. Learning because we think what we learn here in our place might help somebody somewhere else. And then when we combine information together from many places, we're learning together as a body. That's important. Discovery for its own sake. But also having it be mission-oriented, that we have particular problems that are motivating our questions, and we want to get answers to help solve those problems in that place. And so what that means is that we need both orientations. They're not mutually exclusive, and that we want science that's done, inspired by its use, by its intended use, but that doesn't mean just its immediate use. We want it to be generalizable and shared to the extent possible. So what we're going to do during the time that we have this morning and then after lunch is, I've just given an introduction. Andrea will be giving a technical overview, And then we'll have a short period for questions and responses and comments from all of you. And then we're going to split into small group discussions where you'll be asked to generate 3 to 5 examples in your group of implementation-related challenges that you've encountered or heard about or see your colleagues struggling with, and identify what are the related learning needs. What do we need to know? What do we need to learn in order to get past those challenges? And then we'll have a share out from small groups and recap from that. So this will be before lunch. And then after lunch, Rasmi Avila from IFPRI and Kenda Cunningham from HKI will both present case studies that I think will be really helpful to us in terms of sort of visualizing and seeing how this can work in real life. That there'll be, again, reactions for that. And then again, we'll split into small group discussions. And I won't go through the details because, well, I'll forget by then. So we'll go over this again after lunch, okay? All right. So Andrea?
Okay, great. Thank you all for coming. I'm going to provide the sort of technical overview part, the conceptual overview, if you will, because we're going to have the case studies in part 2 that are going to provide more detail on methods and so on. So unfortunately, we're going to keep you at this high level right now, but don't worry, we'll get to the good stuff later. So I'd like to lead in with an example from my dissertation work. So back in around 2013, when the Lancet series on maternal and child nutrition was published, the idea of nutrition sensitivity, which I don't feel I need to define for this crowd, I think, became very widespread and was widely promoted and picked up among academic and policy communities. And around this time, the Ethiopian government kind of picked up on this and decided to make the Productive Safety Net program, the PSNP, nutrition sensitive. Now, this came along with a wave of commitments to nutrition, high-level national commitments to nutrition and reducing undernutrition in all its forms. And so this was kind of one of the early steps, I think, within the whole scaling up nutrition movement to really actualize some of these ideas. And so the process of making the Productive Safety Net program nutrition sensitive was really eye-catching because it's a very large program. It's a large social protection program, one of the largest in sub-Saharan Africa. It's also quite prominent and very successful in many ways, and it had been operating at this point for a little over 10 years or a little less than 10 years maybe. So well established, and they were going to take this step. And so I was very interested in how this idea of nutrition sensitivity was actually going to be put into practice. What's that really going to look like? Again, there weren't that many examples at this point in time of that type of programming that was explicitly calling itself nutrition sensitive. And so that became my dissertation. I developed a qualitative, multi-level, exploratory case study that aimed to examine how the idea of nutrition sensitivity moved into practice in the context of this program. And between 2014 and 2016, I spent a lot of time in Ethiopia trying to figure that out. So the study examined the discourse around nutrition sensitivity in the international academic and policy communities, as well as in national policy communities in Ethiopia. And then I shifted gears to examine the characteristics of the service delivery systems through which the Productive Safety Net program was delivered. So that was predominantly through the Agriculture, Ministry of Agriculture. It was bringing on board the Ministry of Health at the time to work together to do some of the more nutrition-oriented interventions that were coming into play. So I looked at the kind of the characteristics of the service delivery system, and in particular, though, the goal of that was to really learn more about the perspectives of those who were in charge of the day-to-day operation of these systems. So that would be namely the middle-level kind of bureau officials in health and agriculture, and the supervisors of the frontline workers, so the middlemen, if you will. And then I took it, one step further. I took it to the community level and wanted to understand more about the perspectives of program users and their immediate surrounding community to try to learn more about how well the program was actually aligned with their experiences and needs in a business as usual sense. and try to learn something about, how this program was actually going to affect their day-to-day when the proposed changes to make it nutrition sensitive were going to go through. So, why do I give you this example? Well, I think as a lowly, naive grad student, back a few years back, I was not kind of the first to study implementation in its own right or to understand that one could learn from practice. And kind of the bigger point there, though, is that, again, as somebody, I didn't even have the language for implementation science at this point. I didn't realize that this was a field in its own right. I think this is actually helpful to point out that the issues, I arrived at this point by myself in a way, or, with Ed, obviously. But the issues that implementation science is raising are not new, and in all likelihood, many of you have already seen in your own endeavors the need for this type of learning that implementation science can facilitate. And you've probably already found ways to address them. So what's new about this kind of effort around implementation science now is sort of the attempt to provide a systematic way to think about, carry out, and talk about the study of implementation. So let's delve a bit more into that. And so like I said, today I'm going to give you, in the next 20-ish minutes, I'm going to give you kind of this overview of the current landscape around implementation science, the different perspectives of the people who are at the table at the moment. And like I said, we'll do more case studies in part 2. And then I'll give you kind of the simplified propositions that we've developed for implementation science to kind of help provide a unified way of talking about this. And then we'll give some takeaways. So very broadly speaking, there are kind of 3 dominant perspectives that are characterizing implementation science at the moment. And so the first, and the one Ed kind of presented on more, is this sort of biomedical perspective. And the starting point from the biomedical perspective is this issue of we have evidence, we have basic science that needs to be translated into practice. How do we facilitate that? How do we make that happen? And so this is kind of oriented more to health-specific settings, to clinical settings, and so on. And so an illustrative definition here comes again from the National Institute of Health. And they define implementation science as the study of methods to promote the adoption and integration of evidence-based practice and so on into routine healthcare and public health settings. Now, another perspective that's out there right now that's kind of shaping the way we talk and think about implementation science is from more of a strictly programming and policy perspective. And so the starting point for kind of that orientation is to improve the implementation of a specific program or policy. And an illustrative definition for that perspective comes from this Sisson paper, that was published with Society for Implementation Science and Nutrition, and it defines implementation science as an interdisciplinary body of theory, knowledge, frameworks, tools, and approaches whose purpose is to strengthen implementation quality and impact. And so this is a little bit different from the NIH one. You can see it's a bit more kind of mechanistic and functional. It's intended to be used almost as a sort of checklist to kind of help a programmer walk through how they might go about constructing implementation science around their program. And so the third dominant perspective is from the health systems perspective. And the starting point there is about systems functioning and alignment and articulation of and between different systems. And the definition here that's actually really useful comes from sort of a how-to guide published by WHO for implementation research. And it defines implementation science as the scientific study of the processes used in the implementation of initiatives, as well as the contextual factors that affect these processes. And so, in comparison to the first 2 definitions, this one's quite a bit broader, actually. It opens it out in an interesting way and gives you a bit more leeway to sort of look at broader issues around implementation. And, they kind of helpfully illustrate that in saying that the purpose of implementation science is to understand how health interventions work in the real world. And so, one caveat here, these are not mutually exclusive. This is, again, it's a very broad categorization of three dominant perspectives that the folks who are engaging in implementation science today kind of bring to the table. So it's not that there isn't room for overlap and that overlap doesn't happen. This is, more of that high level differentiation. So what's kind of interesting, despite the differences in how the different perspectives define implementation science, the goals of implementation science are articulated in very similar ways. And you can see here, so from the biomedical perspective, taken from a recent funding announcement for implementation research, they say that implementation science is meant to close the gap essentially between research and practice. And then there's also this similar language in another location, close the knowing-doing gap. And from the policy and program perspective, the Tomilowicz definition, they say that implementation science is intended to address the know-how gap, and then from the health systems perspective, address the know-do gap. And so really, there is quite a lot of agreement actually about what implementation science is meant to accomplish. Those who do this work seem to agree that it's really just meant to bridge research and practice. And so that's obviously quite a high level goal. The more sort of specific contributions that the different perspectives envision when they're talking about bridging research and practice are also articulated in fairly similar ways. And so from the biomedical perspective, they say that implementation science should be used to identify, understand, and develop strategies for overcoming barriers, and also to identify when there is a need to sort of de-implement something that's not effective. And from the program and policy perspective, it's similar, identify and address bottlenecks, but also kind of work to scale up, provide the knowledge needed to scale up interventions and develop strategies to enhance the utilization of existing knowledge, tools, and frameworks. So again, this very kind of functional perspective. Now, the health systems orientation offers, in addition to those kinds of contributions, it also, brings it back to learning and kind of articulates the contributions of implementation science as a way to help organizations build their learning capacity in sort of an iterative way and also contribute to health system strengthening. So kind of across these three perspectives that I've just showed you, there are a number of sectoral or disciplinary differences that will tweak the application of implementation science. And we find that kind of the very breadth and openness of implementation science to adaptation can make it actually really difficult to envision what it's going to look like in practice. And so kind of before we fall into a discussion on the vast world of methods and tools that can be used in implementation science, we think it's actually really helpful to bring it back a couple of steps and to focus on where there is agreement across the perspectives in terms of, sorry, that's my place. Right. So where there's agreement across the three perspectives in terms of the rationales that drive the development of different implementation science approaches. So we found these kind of three main areas of agreement across the perspectives. So the first is that in undertaking an implementation science endeavor, the way you frame the question that's guiding the effort is crucial. It's absolutely key. And following from that, the methods that you select to address this question will be appropriate to the question. So you don't start with your methods and then go to your question. You start with your question and then identify which methods are appropriate. And then the final point of agreement is that implementation science is really demand-driven and that collaboration is key. So collaboration with implementers, with end users, with however you define your stakeholder communities, collaboration is absolutely needed to kind of build the science. So, we thought about these different areas of agreement, and we wanted to kind of reformulate those into propositions that would kind of simplify and distill what it is about implementation science that attracts all of us to it, and develop these propositions to help communicate that value and help us talk to each other about this work. And so we have these three here. So the first is that implementation science is distinguished by its aim to learn about implementation. And then the second is analogous with the second area of agreement, methods derived from and fit with the aims. And the third, implementation science is built with experiential learning and tacit knowledge. So let's go through these a little bit more. So the first proposition, implementation science is distinguished by its aim to learn about implementation. We say that implementation science aims to generate the knowledge needed to improve the implementation of an ongoing or future effort. And so where this is distinct, this is quite broad, but it also makes a fairly subtle distinction here. We're saying that implementation science is not limited to producing judgments about specific programs or policies, which is kind of where evaluation territory in the purest sense begins and what it's really meant to accomplish. And so implementation science, in kind of the application of it, it actually gives you the leeway to ask these bigger questions about your programming. And so let's return here to the examples of big questions that Ed gave earlier. You can see kind of in going through these how they are different from evaluation questions in a sense. They are not aiming to just measure, to the extent to which something occurred. They are asking broader questions. And it's also not to say that implementation science can't include questions about programming, just that it opens it up. So we have these examples. How can programming be integrated into and strengthened in existing systems and platforms? How can data and implementation learning be used to improve quality and coverage of services? Some more examples. How does one motivate individuals to adopt and sustain behavior change? And so on. So again, following from that, this one is quite straightforward in its way. So methods then derive from and fit with the aims of the questions that you choose. So one thing that we think is important here, though, is that qualitative methods should really be elevated in the application of implementation science. They're particularly well suited to capturing this tacit knowledge that is absolutely crucial to helping all of us kind of think through and learn about programming. So just to provide you some kind of concrete examples, here are some of the different rationales that different institutions have for the selection of methods to use in implementation science. So from the health system's perspective, they think that any sort of method or design that you deploy in implementation science should aim to generate actionable intelligence, should capture the subtleties of context over time, and offer the iterative flexibility needed to respond to change. And so they suggest, some implementation science methods that are well suited to doing this would include pragmatic trials, quality improvement studies, and participatory action research. And they kind of nicely echo this point, in that it doesn't really make sense to try to define implementation science by its methods alone. It is the question that determines the methods used. And so, kind of a similar example from more the biomedical perspective, they sort of suggest that when doing implementation science, the methods that you select should aim to identify, understand, and develop strategies for overcoming the barriers to adoption, adaptation, scale-up, and sustainability of interventions, tools, and policies. And their suggestion is for somewhat more kind of trials, these sorts of more randomized controlled trials and rigorously kind of tested sorts of research designs. And now this is kind of an interesting one. This is from a recent request for applications for some funding to do implementation science from the Eleanor Crook Foundation. And it betrays a sort of hybrid biomedical programming policy perspective on what implementation science is meant to accomplish. And so they are quite specific in that they say that any sort of research that they fund should aim to test innovations and delivery mechanisms in terms of feasibility, acceptability, effectiveness, or efficiency, certainly with an eye towards scaling up these types of interventions. And they note here that implementation research does not focus on research for academic purposes. So again, going back to Ed's point about mission versus discovery-oriented science, I think that we have a sense that implementation science doesn't need to necessarily exclude either. It can be both. So our third proposition, implementation science is built with experiential learning and tacit knowledge. This is sort of a tricky one. There's widespread recognition that a collaborative approach within implementation science is really part of what defines something as an implementation science initiative. So as we were thinking about what makes that so, we thought it was important not just to acknowledge that collaboration is key, but to really highlight the importance of tacit knowledge and experiential learning in building the science. So implementation science inherently engages multiple stakeholder groups. But as far as tacit knowledge and experiential learning go, when does it apply and whose matters? And in developing this proposition, we thought it was kind of best to leave those questions relatively open. And just note that there should be collaborative engagement with relevant stakeholders at any or all of the stages of developing an implementation science initiative, from the articulation of priorities, the generation of questions, the identification of methods, and the use of results. Any questions from the part that we've just delivered? And then we will move into the small group discussions and a share out. So and we can leave this slide up here to guide the small group discussion.
So any comments, reactions, questions, objections? Yes, sir.
So what do you mean by country level scale up?
Well, I can give an example. So in the Alive and Thrive program in its first phase, when a commitment was made to work in 3 countries, in Vietnam, the health system really didn't have the capacity to implement the interpersonal counseling that was needed as part of the program that was designed. And so a social franchising model was used to build within the health system the ability to provide that capacity and counselors to do that work. And that was done in about 1/4 of the country. There's 64 provinces in Vietnam, and it was implemented in 16 in a relatively short period of time. So it wasn't the whole country, but it was a large portion of the country. The program that Kenda's helping to lead in Nepal is in a large portion of the country as well.
The reason why I say that also is the fact that in countries there's a wide diversity if you take any country within country. So sometimes the idea is that if you are rolling out something that works in one place and you roll it out the same way, then you get frustrated because what you expect to work when you are doing it the same way across a very diverse setting, you don't see the outcomes.
Well, you've identified, we were just talking about that at dinner or lunch or somewhere up in the lunchroom the other day, it has to be, I think the way Andrea was talking about it, you have to find where there's agreement, what's common enough that you can work with that while being as flexible as you can about the nuances of particular parts of the country. Vietnam is an interesting challenge. There are 54, 53, depending upon how you count, ethnic groups in the country that all have their own language. And so it can be really challenging to do it, but it's about finding what can you build around that works well enough and is open enough to nuances in particular places. And that's one of the reasons we need to learn how to learn and sort of be able to do that. I've worked a lot in Bangladesh with BRAC. BRAC was the implementer for Alive and Thrive. BRAC is an amazing learning organization because what Andrea described near the end about organizations that are able to try something and then learn from that and then build on that and then bring it to other parts of the country and adapt it if necessary. That's what we collectively need to learn how to do better. But you're exactly right about that challenge. Other comments? Sir?
I'm Dr. Nikhil from Public Health Foundation of India. So my background is in biomedical public health sciences. So in the definition that you showed, context was an important part in the definition of health systems, whereas in the other two it were not. So I was just wondering, how do you contextualize context in terms of agriculture and nutrition? Like, what does context mean? Like, for example, health system, a context would be, a primary health centers, doctors working there, the nurses, the policies that are in place, the rules and regulations. So they form a part of a context. So what would context be like in agriculture or nutrition?
Let's see. So I think what you might be asking, correct me if I'm wrong here, is how do you identify which parts of the context are relevant in a given kind of, if you're trying to do this? Yeah. That's the $1 million question, isn't it? But I think there are, we'll get more, I think we'll provide more of that detail in the case studies, how they went about doing this and identifying this, because it will kind of be fit to purpose or suited to purpose. And so, as well as to the constraints, that you may be under in carrying out something like this. So it's a design question, but I think we'll have a pretty fruitful discussion about how that, and they'll shed some light on how that can be done, less abstract than what we've presented here.
Thank you. I'm Charulata. Just one question on where do you look at process documentation contributing or accompanying implementation science? What is the level of importance you would ascribe to this part of it?
Process documentation?
Yes.
You mean as would be typically done in a process evaluation? Or
just documenting how the entire exercise has happened.
Oh, I
because
see.
we're not looking at impact from what I understand in implementation science.
That's obviously important. I mean, information about what is actually happening on the ground with the implementation is crucial at some point in the development of understanding, because that represents what's the actual experience in the system where the attempt is being made. I think that oftentimes what we see is that there are monitoring systems in place that help provide some of that information, but then the challenge is how does that information then get used to actually then feed back and improve the implementation. And so surely that will be part of it, but that's only part of it. And we need to do more at the front end to make sure that what's the processes that are in place are the best processes, perhaps, and then to use information to continually refine them.
Yeah, okay. I am Professor Surgeon, mainly representing the academic institutions pertaining to agriculture in India. So what is the role play of academic institutions as far as the implementation of science? Do you have any examples where other countries, the academic institutions, integrate with the implementation sciences and all?
So you're asking how can academic institutions contribute to this? I think that's a really important question. Part of my answer to that is that we, first of all, and I think that's what we're trying to do here, need to recognize that this is scientific activity that's worthy of attention. I mean, I was, not my current institution, but in my former institution, I did occasionally have enlightened people ask me if what I was doing was really science, all right? And I said yes, but we want it recognized and understood among us, but also with our colleagues that yes, you don't always have to, I don't know, show impact on some major health outcome for it to be worthwhile activity, that investing in how it happens in those processes is important, and that we should be supporting that as academics. As a department chair, I should be supporting that. So that's certainly one way. But I also think that I'm not so much a fan of the, I don't know, the differentiation between research and practice, although that has some value. I think the larger message here is that, as you know, as Andrea was emphasizing at the end, that there needs to be collaborative engagement with people who don't normally think of themselves as scientists, but yet are learning and have systematic knowledge in their head that can be shared with people who do see themselves as professional researchers, and that mixture together will advance the knowledge that we need to have. And clearly academic institutions are going to play an important part, because oftentimes it's people there who have the flexibility to come in and collaborate. Kenda and Andrea and I are collaborating on a project in Nepal, and I think we're getting along very well, and but I think we have strengths in our institution and resources we can bring to bear, and she has from her side and her colleagues, and that kind of fruitful collaboration is we need to see more.
Ed, I just wanted to add to that, actually, how academics work with those in practice. And I found that although those in practice don't reach out to academics, and the other way is also true, when the two come together, they find that it's a good space for them to work. And so I have sometimes invited myself into meetings. It's like just crash into those meetings where they're making decisions that I may have done some research in. And I sit in and we have conversations. And initially they are skeptical. Who is this? Why are you here? But eventually they find you useful, and then they engage with you. But what it's also rewarding personally, because then I can start answering questions that are relevant to them. Then I can also identify questions that they need answers to. But the thing is, we are not set up to work together traditionally. So you would have to find ways that work within your context. I believe a number of us work in Sun countries, and the Sun movement actually promotes having academics involved in that process. And I think you have to find a way to break through that process, or that differentiation between academics and those who are not academics. So
you're absolutely right. So one of the things we hope will come out of today in our discussions is you're sharing with each other how you've done that, because we need to have more examples than that. And you're willing to crash the wedding party, but not everybody is quite so bold. So how do we make it more possible for those kinds of conversations to occur? Okay, let's move from here so we'll have enough time to the small groups. Do you want to talk about that?
Okay, so I think we have about half an hour at this point. Yeah, okay. So we can maybe do share out after lunch if we want. 20? All right. So for the next 20, 25 minutes, we're gonna have you guys break out into small groups and address this bullet point here. We'd like you to generate 3 to 5 examples of implementation related challenges that you or your colleagues have encountered from your different perspectives. We really value the diversity of perspective here and the diversity of background. So we really want to hear it, from agriculture, from nutrition, from health systems, and so on. And once you've kind of done that, you've identified these challenges, then go through and what are some of the related learning needs that the things that you would need to know in order to kind of overcome or move past these challenges in some way. And so after that, we will have a few minutes for share out, I'd say. So, if you're comfortable at your tables, you might want to even out a little bit. Let's see.
Right. The easiest thing is if you're at a table, just start talking with your colleagues. And I guess I would say, if you want to come up with 3 to 5 examples, that's great. If you decide there's only one and that's the one you really want to talk about, that's okay too. All right. So, yeah, and if one person at each table could just take some notes so that you can share that out at the end. So if we could just start with a table and just take like 2 minutes to tell us about your challenges. Kendra's going to write them down, and what you think you need to learn about them. A volunteer table. You're volunteering, or you're volunteering her. Okay. Here you go.
We did discuss about the agriculture, health and nutrition. So colleagues from Africa, they talked about the issues with aflatoxins. So in peanuts, so if we feed the aflatoxins in affected peanuts to the animals and then we are consuming the milk, so the aflatoxins can be transferred. So that was one part. So we find the challenge of convergence, like 2-3 departments are involved there. So how to tackle that convergence challenge and throughout the value chain of that agriculture products. So that is one aspect. Anyone wants to add on that? So we talked about two main implementation issues we discussed. One was how to bring convergence, and second was how to sustain that convergence which is there. So this was an agriculture-based intervention. Then the second, we discussed about the typical nutrition and health-based intervention program, which is our National Iron Plus initiative, where we do have in the policy that a specific dose, specific supplemental iron dose has to be given. But when we see in practice, the dose that is prescribed is not available. So, I mean, that is the implementation challenge we have. So these were the two things we discussed, yeah. We were still in the process of discussing more. Yeah, for other programs, like we have our ICDS program, the growth monitoring program, we did discuss challenges, implementation challenges of the frontline workers, the capacity for growth monitoring, as well as counseling, like some of the basic services which we say are essential, but then do we have the capacity to, do our frontline workers really have those capacity? Yeah. Thank you so much.
Hi, we discussed 2 examples of different projects, but ours, Nicola and I are working on a project in Pakistan, which is all about introducing a new type of flour, which is biofortified with zinc and iron. And our project is in a remote community which has very traditional, conservative set of beliefs and perceptions. And so we've come upon a number of challenges and I guess, suspicions about what's really in this flour and what's it going to do to us. And I guess our starting point for dealing with those kinds of challenges has been to consult carefully with established committees of village elders that exist in this area. And that's how we communicate with community members. We've also got implementation challenges that we're exploring at different levels of the system. So working with farmers to find out about whether this wheat can grow just as well as their usual crop. Do they need to apply different quantities of fertilizer? Is it going to be cost effective for them? And then looking at how national scale-up might be happening in the future. So we've been working on mapping different elements of the wheat system in Pakistan, and thinking about some of the challenges and the interactions between different stakeholders nationally. So I guess it's been great to understand more that our project is doing implementation science. And one question within our group was about how, do you have to design your project as being implementation science? And our response was very much, well, we didn't have that term in our grant application, but it is a big part of what we're doing, so that's great.
Okay, so we had very good discussions regarding the challenges regarding the implementation of program in different parts. So, but I'm not sure whether I was able to summarize all the discussion points. So basically, the thing is that the beneficiaries they think the program or the intervention in a different way than the programmers and the planners. So it's a real challenge how they understand the program and what is the intent of the program that the beneficiaries need to understand so that they can participate actively with the knowledge of the program, so that the programmers can achieve the desired outcome from the program. And the other major issue or the challenge that we found is because we have many overlapping programs, especially in the developing countries, and due to the overburden of the programs and because of the lack of the monitoring and evaluation activities, so it's really difficult for the programmers and implementers to understand what is going on actually in the local level. So it is also a real challenge to implement any program or intervention. So that's it.
Hi.
Good. Yeah, I volunteered. Yeah, so I hope I'll present the team properly. My name is Mark from the African Economic Research Consortium based in Nairobi. One of the challenges we saw is the fact that we have problems in scaling up interventions which have succeeded in regions, and we are not really able to translate that to the national level, and we think that maybe more inter or multi-sectorial interventions are required for coordination. Another problem or challenge is that there are certain interventions that we think are good in some of the projects, like milk consumption and even egg consumption, but you find that individuals don't consume this, and we think some kind of a behavioral change probably is needed, but we don't know how to go about that. Another point is gender mainstreaming in programs. We find that in some programs, you may say, all right, let's have both male and female included in the project, but actual participation will always, play out differently, so that you find it will be skewed. An element of branding of projects also came in, because once you talk of nutrition, it tends to lean towards certain gender, then you find that participation will really be affected depending on the naming of the project. Another element is to do with policy. In the African Economic Research Consortium, we say we do research to inform policy making and implementation. But we do a lot of research. You present the research to policymakers, but real implementation of that is a problem, because you cannot quite say, we did this research and the implementation of the policy is this way. So it's difficult to relate those. There are many others, probably because I volunteered, who can finish up. You want? Yeah, please. Okay, there are other elements like short-term programming vis-a-vis long-term results that, you can say they're sustainable. The point is we run programs which are more interested in getting results for that time, but whether they're sustainable in the future is questionable. So at the end of the project, you find that you don't have results that go into the long term. Okay, I think I can stop there, but my colleague wanted to add something.
Yeah, actually, we were also discussing around gender, especially in the Indian and even Bangladesh context, with the respect to acceptance. I think other groups also have discussed around this. We have found that it is basically the women who seem to be accepting more when it comes to the nutrition or the nutrition diversity. But where men are not cooperating, they find it a challenge. Even the projects find it a challenge for the implementation part of it. That's what I just wanted to add. Thank you.
Thank you very much. And one more group, please.
Hello, I am Professor Sarjan, Veterinary University Dean from India. We have 8 people, all Austria, US, and mainly Bangladesh, India also. So because these are the countries, mainly the India and Bangladesh, really suffering with a lot of issues, mainly malnutrition, hunger, those issues. I think this group has contributed a lot in this process. And we have 5 real suggestions or maybe challenges we could identify. So the group has endorsed me to this. One is outreach of the technologies. We have a knowledge pool in all the countries. We have wonderful technologies, but how best this technology can be transferred, outreach, and if technology is successful, how best we can scaling up. So this is a major challenge, mainly with the highly, thickly, densely populated country like India, Bangladesh, and China. So this is the biggest challenge. In addition to this, the age-specific technologies, like the India has millions of the neonatal deaths are happening. So more than 87 millions of the children dying in India every year because of this malnutrition. These are the data given by IFRI and FAO also. So this is the biggest challenge, outreach and also scaling of the technologies to combat the malnutrition and hunger. The second challenge we could identify is the technology always should be country specific. That is what our experience says, because a successful technology elsewhere in US and other developed countries really will not have a help countries like developing countries like India. The technology should be country specific and within country also location specific. We have got a wide range of topographical conditions. The people perceptions vary, people's resources are vary. So the technology should be a country specific and location specific. So this is another challenge to design a technology which suits to the location specific. So that's the issue. Coming to third challenge, now today morning also we had discussed on the accuracy of the data being shared. Now this is the digital era. We are getting a lot of information and world is very small. I get a lot of information data with a reference or without reference. How can I believe this? I say it's India has got wonderful crossbred cattle. They are not possessing A2 gene. So that is a really alarming situation. This is a kind of rumors goes through digital media. So how best you can take these challenges, how to get accurate data to reach the community. Because everybody possessing a smartphone, he gets the information, but the information may not be accurate. But he believes, the community believes. This is another challenge, how best you can address the community with a accurate digital data. The fourth point we could identify is this is ANH, agriculture, allied sciences, nutrition, the human nutrition of different ages, and health. Unless we have a specific very good coordination among the three implementing agencies. It is very difficult because it should go in a one portal, but it is not happening in most of the countries. There is lack of coordination among all three departments. Unless you achieve a coordination, it goes through, because every country possesses different ministries at the policy level. So unless you have a coordination among the three groups, we cannot really, this is another challenge. So everywhere, every country is facing. Then the fifth one is, why don't we explore the ethnic foods, the country-specific ethnic foods, add to the value to that? And why don't we explore the unconventional food ingredients? So they are the real promising. If you reach a community, tell something which is available in somewhere in a developed country, try to bring it, that's going to be a failure. Especially we have you can see in the stall, Indian foods on the tables and the nutritive values, published by NIN. You can see the ethnic foods really are the promising. The challenge is how best you can take this ethnic foods, value add, then reach to the community. These are the few things. Any point to be added? Yeah. So ultimately we felt that the performance, participatory rural appraisal, let's say, while doing survey, we need to involve the community to know their difficulties and need. So these are some of the issues I think they have endorsed. I think I have communicated.
Great.
Thank you very much.
Thank you very much for all of you.